We have just gotten some exciting results from a long-term study we have been doing for about 4 or 5 years. And this study is looking for signs of inflammation in pregnant women. So many things can cause inflammation in our bodies, and these factors can actually affect the brain. So they can pass the barrier between the blood and the brain, and they can bind to nerve cells and actually make us feel sad and depressed and anxious in different ways. And it turns out that you can also get inflammation being increased during pregnancy. This is a study where my lab at Van Andel Institute has worked together with 2 important hospital institutions in Grand Rapids, Michigan, with Spectrum Health for the delivery wards and with Pine Rest. And Pine Rest is focusing on postpartum health and women who develop severe depression and suicidality after giving birth.
So this research was an effort to better understand perinatal depression. This type of depression can affect 15 to 20% of women during their pregnancies. If they're struggling, if they're having depression, our goal is to try to help them through those moments.
It's significant in this study that we were able to pick a biological signal up before the women actually fell ill. That's really important, and we haven't been able to see that before.
She noticed that during pregnancy, the placenta was an incredibly important source of these inflammatory markers that she had been studying, and wondered whether these might have a role in the pathogenesis of perinatal depression. So we decided to begin to work together to see if we could better understand that question.
Working with these clinics, we've been able to enroll women already in the first trimester, and then we've met them over 4 different research visits over the entire pregnancy and in the postpartum. And we have registered their symptoms, how they're feeling. We've taken blood samples. We have analyzed placenta tissue. So we have a lot of information about all these women.
For women going through this, the ability to detect and then hopefully treat depression is incredibly important, not only for her mental health, but for the health of her newborn and maybe other children in her family.
We're so grateful to the community for participating and helping us to perform this research study.
Often when people are struggling with a mental illness, they've lost the ability to hold on to hope for themselves. It's our responsibility to bring that benchtop research and combine it with the clinical work we're doing to really take our understanding to the next level. And that's why a collaboration between Pine Rest Christian Mental Health Services, the obstetrics and gynecology clinics at Spectrum Health, and the Van Andel Institute is so critically important.
It's extremely important to have good clinical collaborators to be able to analyze and put these results together. We're really working together with the goal of transforming human health.